So today I am honored to and want to introduce you to Thomas Dahl, who is um, a special guest. He is sharing office space with us. He's not part of our practice. And he does integrative body work. So Thomas, can you unmute me, make everybody go away? And then I'm going to have you unmute and um, I guess I can't make them go away. So Thomas, go ahead and unmute and then start talking. And please introduce yourself and tell us what integrative body work is.
Oh, hello everyone. My name is Thomas. I'm an LMBT licensed here in North Carolina, and I'll kind of start with my main focus on my practice, which is integrative bodywork. It's a pretty generic term used to really mention a lot of modalities within the bodywork space. Integrative bodywork is typically what you'll see known as structural integration. It's used a lot in the osteopathic space. You'll see DOs use it themselves a lot. Um, Typically, what it's defined as is just the use of multiple modalities to use and using connective tissue and the muscular skeletal system to correct the body in misalignment and in dysfunction. A lot of times you'll see, especially in my case, the use of myofascial release, sports stretch, which is you'll see typically with just regular massage therapists. Active release therapy, very common with chiropractors and orthopedic doctors, and orthopedic massage itself.
Okay, so you're using different techniques to help somebody with their symptoms. I
Yep.
heard you say myofascial, which so go back and tell us what fascia and myofascia is.
So fascia and myofascia is connective tissue within the muscular skeletal system itself, even within the actual fibers of the muscles themselves. So kind of what you have is a overlying and underlying train of connective tissue that goes throughout the body within the individual muscles and throughout the body, connecting the muscles and the skeletal system to itself. If you think of a suspension bridge and you see those rails and the roping pulling it up and holding it together, where they actually use those cables to keep it up almost like a puppet string, that's kind of how the connective tissue in your body works with fascia.
So am I understanding that just because fascia goes all over the body, so just
All of it.
because somebody is having symptoms in one place because of the fat fascia, it may be connected to something else?
Yes, very rarely and never in my case, and I've never heard of a case where you've had an issue with fascia that is in one spot and not an issue with something else. And a lot of times you'll see it in compensation cases. I know a lot of Dr. Ingram's patients have seen this before. You might have an issue even with your organ, and you'll find that it's bothering your neck or giving you migraines. Typically, fascia is inflamed and it's involved and it's carrying throughout one of the many fascial trains within our body, and you'll see it present itself somewhere else.
So give me an example of something that you can help somebody with myofascial release.
Quite a bit, pretty much anything inflammatory. I've worked with rheumatoid arthritis before, osteoarthritis, um, chronic inflammation systems, a lot of autoimmune typically keeps the body inflamed. I've worked with people with AI stuff, including Hashimoto's. Um,
AI being autoimmune.
yes, sorry. Get prepare myself. I like to use my acronyms. Yeah, so autoimmune disease, thyroid. For myself, it's adrenal. I go and see a deep fascial specialist myself. I learned about it right after my hockey career ended because of my lack of mobility and my loss of range of motion in my hips. So when I found that, that kind of led me into this practice.
Yeah,
Um,
so it helps a lot of things. Now, we talked about myofascial and fascia. What's the difference between a knot and a trigger point?
Trigger points have been heard of a lot, and a lot of times, especially massage therapists or other bodywork practitioners that won't really work with fascia a lot and don't study it, even will get it confused themselves. Trigger points have to actually do with musculature and the muscle fibers itself. So the sliding filament, the thing that allows you to actually contract and extend a muscle, is what causes trigger points. There's an adhesion within the muscle fiber itself in the sliding mechanism that adheres to itself. Think of like a guitar string. It allows itself to expand and contract. When you get an adhesion or a nick on a guitar string, it starts to not be able to function. You'll notice with trigger points, typically there's quivering and it can affect the nervous system, which is actually a shared trait of fascia. But you'll feel quivering. It typically will radiate to a different part of the body, especially on the other end of the same muscle fiber or muscle group. Whereas a fascial knot is an actual adhesion within fascia. Fascial is a gel-like substance, and we get this thing that the osteopath doctors and the founder of a book, a really renowned book called Anatomy Trains, calls it the fuzz. Over time, we developed this cotton candy, literally cotton candy like fiber that kind of it impedes our ability for the connective tissue to glide correctly, and that's what causes the fascial knot over time. And there's many causes for that, all the way from diet ranging to diagnoses to just working out and
So I'm
repetitive.
hearing that things are supposed to glide smoothly and they get kind of stuck together. And that's
Yep.
what you can go in and pull apart and unstick.
Pull apart. Yep. Obviously in complementary practice with other things like taking supplements that are anti-inflammatory, inflammation is typically your number one cause for any kind of connective tissue. You're going to see issues. Most people that have to come the most frequent have some type of inflammatory issue.
So you're getting in there and you're unsticking this saran wrap that's stuck together.
Yep.
D- does it hurt? Do you use your fingers? Tell us
Um,
what it would feel like.
it it always depends on the person. People have different tolerances and people have different underlying issues that go into it. The I guess discomfort range, I'll use that word instead, can vary. It can be painful to some. It can be just discomfort, and sometimes it just feels like pressure to others. I wouldn't compare it to anything like a Swedish or relaxation massage that you typically correlate with the word massage, which is why I tend to use the word body work, and so do others. Uh, you'll feel discomfort, and it typically will feel like a burning stretch. Like you said, that an analogy of kind of saran wrap unfolding, you will feel that stretch through your body. And in the points I hold, I'll use my fingers for more specific areas, especially my thumbs, and I'll even use elbows in bigger muscle groups like hamstrings or quads.
Yeah, and Thomas, full disclosure, Thomas has worked on me and I've had trigger point injections and those I'd say those hurt. This does not feel like that at all. But what's interesting is he may be working on my ankle and I feel it in my rib. So that's kind of an example of how the whole everything is connected. Um, you also sometimes do cranio-sacral because I just heard you say the fascia has nerves. So explain to us what cranio-sacral work is and what you would use that for.
So craniosacral it does use osteopath techniques that are also found with fascia, but on top of that, it works with the dura mater, cerebrospinal fluid, say that three times
So
fast
the
for me,
layers of
and
the
the
layers
layers
of the
of the
coating of the spinal
cranium
cord.
that protect the brain. Yes, the meninges as well. And it uses that working all the way down the spinal cord with the nerves all the way to the sacrum, hence the name craniosacral therapy. It was actually founded by a doctor who found that imbalances with spinal fluid pressure and the meninges and dura mater and different sutures being out of alignment typically led to a lot of issues with not just nervous system, but endocrine system as well. So they started doing that to reset the body is really what it's after, resetting and recomposing, especially that central nervous system response in the body.
So the brain and spinal cord has its own saran wrap, and inside that saran wrap is this fluid. And so what it's sounding like is you get a kink or a misalignment, and then we don't get good flow of that fluid, but we also get nervous system things. What kind of treat symptoms or diagnoses could you work or help alleviate with craniosacral work?
With cranio-sacral, you'll see a lot of migraine and headache work when it comes to more symptomatic. And then a lot of times you'll see people that have chronic fatigue or, uh, again, inflammation response. Typically, inflammation response with CST is worked on for idiopathic or unknown
Now
reason.
slow down. You're
Sometimes.
using initials again. Idiopathic and CST. Can you explain
So
those in?
CST is just craniosacral. So idiopathic or unknown reasons for inflammation response. I know that's a reason a lot of people come to Dr. Ingram themselves, is inflammation without a known cause. You see that a lot with CST. Um, I'd say that those two, and then adrenal and also anxiety responses are typically what you see. People with panic disorder, having a fight or flight kind of coming out of nowhere for not a known cause. Those are the kind of people you'll typically see getting CST work done,
Okay,
along with the headaches.
good. So craniosacral for migraines, chronic fatigue and anxiety and adrenal. Um, what are you doing to what would it feel like for somebody to have craniosacral work?
If you ask most people that have gotten it, they don't know how to explain it. It's a different feeling. I've had it done myself several times under the guise of different craniosacrals used in a lot of integrative work as well. So you'll see someone that does integrative body work that they might just have craniosacral or CST, same thing, being used within the session itself. Um, what you typically, for me personally, it's different for different people. I kind of have a buzzing feeling in my head. And then when I get up, it's kind of a clear sensation, almost like you just took allergy medicine. And for the first time, you can breathe through your nose again. It's that kind of relief feeling, centered through the head, and it kind of shoots down the spine. You can get some tingling. Those are really the only ways I can describe it in a way that'll make sense. It's
But
very different.
it's not painful like the myofascial.
No.
Basically, you're
Um,
just putting your hands
yeah.
under somebody's head and it's real slow. It's not painful. It's actually very relaxing.
The only time I've ever seen discomfort with it is kind of around it's the occiput protuberance. It's right here at the base of the skull where the spine meets meets the cranium or the skull. That's really the only spot of tension because there's so much musculature and other issues happening there as well that kind of blends back into that integrative body work that you'll see discomfort, but it's much more of a, like you said, a light touch, a reaffirmation, readjustment kind of feeling
Yeah.
that you would typically associate well, maybe with like a deep tissue massage, relaxing, but you still feel a difference afterwards.
Yeah. And I hear people say their brain feels lighter or clearer.
Yes.
Mm. Kind
Yeah.
of a different subject. What can you do for TMJ and jaw pain?
TMJ and jaw pain, that kind of will flow in between both, actually. A lot of the sutures that are formed when we are developing um, as fetuses is typically where you'll see a lot of movement that I find causes issues with TMJ, along with, I'll just keep it simple, the cheekbones as well. You'll see a lot of movement there, along with the lower jaw. Um, so with both craniosacral and integrative body work, typically we do a ART or active release technique with that, where we have people open and close their jaw, holding the spot on the masseter muscle, which is our big chewing muscle on both sides. We have two masseter muscles. We will work that at the TMJ joint, which is what TMJ stands for, temporomandibular joint. Um, and we work that externally, gliding both laterally and vertically with those jaw movements that I have a client do, to get a release. Sometimes someone will feel an instant pop. Sometimes it's more of like a gliding stretch that starts to get easier and easier as we go along.
Yeah, and I want to back up because I heard Thomas mention sutures. And so when we are babies, we might know about soft spots on the baby, which is where those bones in the skull haven't fused together yet. Because when the baby is being born through a little bitty hole, the bones in the skull actually fold over each other. And then when the baby's born, are supposed to round out and then they're supposed to seal. But what integrated body work therapists are showing us is that they can still move a little bit, even though those sutures are supposedly sealed. He can use them to move a little bit, and that includes what's going on with the jaw. Is that a good synopsis?
Yes.
Okay. Um, how many, how long would someone need to work with you with TMJ and jaw issues that have been going on for a couple of years? Can you help things in 1 or 2 sessions, or do they need to keep coming to you long term?
That is always something that comes down to the individual client, as do most things. I've had people with TMJ and migraines are another one that kind of sit along the line of, is it going to be relief in one session? Is there going to be relief long term? I've had people that have had 3 weeks of relief after their first session with TMJ. I've had people that have had a couple days. It typically depends on, is there a causation to it, especially if there's underlying trauma, especially car accidents. You'll see that it takes a lot more work to get through that. Any kind of oral surgery, there's a lot of scar tissue, other stuff to work through, just rather than just the dysfunction of the joint and the masseter muscle, like I was talking about earlier. Um, it's very variable, but typically we start with more not condensed, closer together, more frequent sessions, and most times differing for different people within those first couple months, you'll see it move to that more regulatory schedule of most people can get to a point outside of the rare few that have a lot of stuff going on, to a monthly or bi-monthly session where it's just more regulatory.
Awesome. So it's going to depend on what else is going on.
Yep.
But it sounds like there can be some relief in just a few sessions. I want to talk about lymph. In my practice, we talk a lot about the lymph system being the drainage, getting rid of toxins. Um, and that lymph system is doesn't really have a pump, and sometimes it gets pinched or clogged up. So what do you do for the lymphatic system?
So kind of the point you started touching on, there's several reasons people might have issues with lymph. Like you said, there's no pump for it, so it's really our actual skeletal muscles that move it. Movement is great for lymph. If you have problems with lymph, and I'm sure Dr. Ingram has told you if you've had a problem with lymph, movement is great. You see the lymph trampolines, they're actual physical therapists that will have people post-surgery, especially people that have had cancer and had lymph nodes removed, get on these little trampolines and bounce. That's one of the best things you can do for lymph on your own. When a practitioner comes into it, there's machines that do it, and they have practitioners as well. It is a very light touch movement, either with a tool or a hand. That's almost like a scraping feeling that goes over the lymph vessels. And when you get to a bundle of nodes, you'll have a light pumping sensation from the same person. All of this acts as a scrape and a pump, if you will, system that moves that lymph towards the nearest duct that allows it to be filtered and drained through the body. Um, you'll see it a lot with post-op patients for different reconstructive surgeries. Cancer is definitely the number one field for lymph work, along with other inflammatory issues, especially post-surgery. But what we do is it's just light movement. It is a longer session. It is a lot slower moving. Um, the feeling I would describe it as, it's like, are you going to start yet? And it's really until you get to that, honestly, typically a limb with really bad edema or swelling, you'll spend 90 minutes on one limb. And about then, for example, I worked on my own mother after she had a surgery for a really bad foot injury. We got her going somewhere between the 60 to 90 minute mark. We were able to get her down 2 centimeters in swelling of her ankle just through this light touch action.
Yeah, so really light. And
Very.
what I hear frequently from people is they don't notice much within the first hour, but my goodness, will they pee that night?
Yep. Most of the time I've had to have people, most times people will request to get off the table. before they notice anything in terms of a feeling, the first thing they'll notice is they have to use the restroom while on the table still during the session. That is the first thing, which means it's filtering and it's draining. We have the stuff that's in the lymph that shouldn't be there, any kind of contagions that's going through our kidneys and being filtered out, which is why you you have that sudden urge. Yes.
And does it sometimes make people feel flu-like, or will they maybe feel bad afterwards?
I've never had flu-like symptoms myself. I've heard of it, yes. A lot of it I get kind of like what I think of as like ragweed seasons right now upon us. That's the kind of feeling I get when I have lymph done. It kind of feels like almost like a sinus infection, cold. It can feel that way and feel stuffy for a bit as it's moving through the body properly. And once it's going through that duct and once it's being let out through our urine, typically that's when you find the relief and the clarity from it. So it's almost kind of like a delayed response where it can feel like it's getting worse before it gets better. Yes.
Yeah. And so what I'm hearing is this is very different. What you do is very different than like Swedish massage or relaxing massage. It's more to treat something. And so do people have to get undressed, or how do you work with people with clothes?
Yeah. So I made a decision straight out of school to do more clinical work, osteopathic work, and all the other things we've covered today. Um, Clothing helps keep a barrier of safety for clients and the practitioners as well. Especially being a male for me, that was a very important message to send to kind of taking the sensuality out of a Swedish and moving it to a more clinical setting is very important for me. We do clothed work only. There's no modalities we have that requires gliding motion of a Swedish relaxation. You can get a lot of actual nervous system relaxation through compression, hence why you see people using weighted blankets. Compression calms the nervous system just as much as a gliding stroke and just as much helps with circulation, all the benefits of a gliding stroke without the need to get undressed and draped like you'd normally see at a massage therapy session. So there's no real true disadvantage. And I very, very rarely have ever found on time where I really needed a gliding stroke. And typically that's on the forearm. And with the forearms, typically someone has sleeves they can roll up or short sleeve on, so it's not a problem. And I have some lotion balm with me if I really need to use it. So I find that it's all advantages, no real true disadvantage.
Yeah, and we got a comment in the chat from someone who said that their lymphatic massage therapist has them undressed, and it really kind of comes down to a personal choice. And what Thomas is saying that is for his practice as a male, he decided to do clothes on. It's not that one is better than the other. That's just his choice.
Yeah, and lymph, there are people that use two techniques. I use more of a pump technique. I can't speak for the machines. I do not work with machines. Um, but some people use a gliding hand stroke where it is better to have skin contact because it is so light touch. It is sometimes people find it, and this is more practitioner based, find it more, they find it better and it's easier for them to feel the fluid movement with skin to skin contact. So that might be why your particular practitioner does that. I was taught two methods in school, so I was lucky enough to be taught how to do gliding and the pump technique through clothing when I got to learn it through school. A lot of LMBTs do not get that during their courses. They have to learn lymph through continuing education. I did a longer hour schooling, so I got to have lymph as part of my education with before I got my licensure. So there's the difference there as well.
So we've talked about you do myofascial or fascia, you do lymph, you do cranio-sacral, you can do stuff for TMJ. What other types of massage or modalities do you offer or do you plan to offer?
So I offer all the above. All these kind of really fold into both what we call the cranial suture therapy and then integrative body work. So we offer those two right now, and we do also do cupping. Cupping's been around for years. Eastern medicine, that's become a Western thing. It's pretty much intentional bruising. It is bruising. brought on by this suction, and it helps relieve superficial fascial issues, and also can be used diagnostically if I'm finding there's a lot of over-connecting issues and I need to find where I need to work the most. It is a great tool to use to see where's the bruising the worst, where am I getting patina, which is the speckly kind of look that we get from the capillaries drawing blood to the skin. I use that to know where to work and where the actual underlying issue is coming from, specifically within the anatomy. And also, it's just good, especially if you're active and you do sports. It's a cheaper alternative to having to go into a full-on session. It's a good regulator for the body. It tells the body where to go and where to repair. So I offer that as well. And we're looking to get in, especially with TMJ and some of the more, looking to get into the modality of intraoral, which is the use of gloves and actually working the masseter muscle and some of the cranial muscles, the palate of the mouth, and other things like that within the oral system using gloves. That is required by NC law. You have to get continuing ed and a specific license for it. As well as we're looking at Yamuna body rolling. That's just the name brand. There's a generic education as well, which is the use of different weighted and different textured balls. And it's something that we're looking to incorporate into the integrative bodywork therapy that allows us to, one, take stress off my hands for longevity purposes, but also it allows for more leverage using someone's own weight for themselves versus me working against it. So those are the two big ones to come here in the future.
Okay. And
So,
cupping, for people that don't know, is using usually a glass and making a suction on the skin, and then it does leave like a bruise or a hickey or little red dots. That's what cupping is. Um, if people are interested in working with you, how do they know if you can help, and how do they find you and schedule, and where are you geographically?
so I'm out of obviously Dr. Ingram's office and also a office on Battleground, right across from Red Cinemas. I have business cards currently in the offer services pamphlet in Dr. Ingram's office at the front desk currently. You can find me online at GSO Thera, like the beginning of therapeutic, THERA collective.com. And that's you'll find that the location for that is the battleground location. So I work out of those two locations, varying based on the time of day, Monday all the way through Saturday, working out at Dr. Ingram's or office Monday, Tuesday, and Thursday at the moment. Um, and business card, phone, and definitely booking online through the site is the best way to find me. I also have my email out there. I can type that in the chat if you want as well.
Um, yeah, if you want, and then we have a newsletter coming out in October, and this video will be in there, and we'll also put the link in our newsletter. Or if you want somebody wants to send a portal message, we can always send it to you. But Thomas does use an online scheduling. It's not like you call the office and schedule an appointment, and you don't call our office because we don't schedule for Thomas either. And just be aware that if you book for him on a Wednesday, it'll be at the Red Cinema Battleground location, not here in our office. So awesome. That's very good information. I've worked with you for a while, and I even learned some information today. Anything else you wanted to share before we open up and we have other people ask questions?
Nothing on my end. I'm ready to answer any
Okay.
questions anyone has.
Um, so if anyone wants to unmute and ask questions, this would be a great time to do that. And I haven't figured out how to get everybody back. Or you can use the chat. Let me check the chat. No, thanks. Yeah, the information is in the chat with the GSO therapeutic. They're a collective. Maybe it's right here. Okay. All right. Wendy, you're unmuted. Did you have a question?
Yeah. So you talked about post-op. I've had 4 surgeries on my right hip, and the last 2 years, and uh, I have. They told me I have venous insufficiency on that, so it's on my hip and then down at my ankle. Both at the ankle bone, there's this soft bulge, and then at the distal portion of my, like my calf is bulged, but it's not the soft edema. It's if you were to manipulate it, it almost feels like a bursa or something. But people mention venous insufficiency and then lymph, and I went and saw somebody for lymph work. I had 4 sessions, and she did both. She mostly did a little wand, those little glowy wands, and then some light pressure. But none of it was effective for me, and I don't know if there is some other approach that would be.
I've never heard of the glowing wand. I know there's some very expensive machines out there that they have, especially at cancer centers. The main one is going to be the light touch. Um, Depending on how long she took and if it truly was a lymph issue, especially with surgery, which more than likely there is, um, it's hard to say without seeing it or have been the practitioner myself. But lymph, manual lymph drainage, and then there's also the suction that the machine uses. They can have differing effects for differing people. The most interesting part though is the location of these kind of harder edema. It sounds almost like a scar tissue issue with the post-op. Um, I wouldn't say complication, but symptoms. Stuff like that can get in the way of lymph node and lymph vessel and restrict it because that light touch isn't going to move through anything that's truly constricting it. Um, Lymph therapy really only works as a pump. So if there's something actually disrupting the pump, that's a whole different thing that needs to be addressed separately. I've worked with someone before that had an issue with their Achilles tendon. Um, this was just from repetitive motion and a history of plantar fasciitis, which is just that splitting feeling from anybody who's runners in here knows what I'm talking about. Splitting of that fascia at the and connective tissue at the bottom and musculature at the bottom of the foot. Um, they had a similar thing. It was kind of like this hard nodule on their Achilles, and what it took is actually a lot of heat therapy with because we do hot I do hot bamboo at the other location. We have hot bamboo that we use for heat therapy there. Oh, along with very, very hard acupressure and integrative body work to come from a hard nodule to back to like a gel-like substance, like we were talking about earlier, and it ended up for them being fascia and a tendon issue for them. So, like I said, without seeing it or feeling palpating it, I can't speak exactly on it. But typically, anything like that and anything post-op, there's a good chance they've disrupted lymph vessels, especially with the hip replacement. You have a big node of lymph lymph nodes, or a big patch of lymph nodes. I mean, right at it's called the femoral triangle, right at the top or bottom of the hip towards the top of the upper leg. And there's a good chance some of that was disrupted during the hip surgery, especially if you've had four on the same leg. So there's a lot going on there that would need to be worked on before you would probably see results that actually affect the edema itself
Yeah.
or the lymph movement that you would need.
And the ones that she was talking about, they use it healing space and it is for lymph, but sounds like scar tissue it is we know it's a big issue. Scar tissue just plugs up everything. Thanks, Wendy.
Thank you.
Janie, you were unmuted earlier. Did you have a question?
Yes, I did. This is so interesting to me. Would I suffer occasionally with ocular migraine? Would that be beneficial for me? Something to look into? Where
Yes,
it's
in my
okay.
humble opinion, yes. Like I said, I've seen deep fascial specialists for a long time. One of the versions of it is called Rolfing. That's a whole nother ball game to get into, a whole nother. A lot of my technique comes from an understudy of someone that used to be close to me. That is a rolfer of 30 years. Um, and I had ocular migraines. I used to be a project manager before I went back and got my LMBT license. So I had right side ocular migraines, and he did suture therapy for me with especially my zygomatic arch, which is where we're attaching to that cheekbone here. And it was actually from hockey and getting pucks to the face because I played goalie. Repetitive impact here that was causing my ocular migraine. So had a lot of relief, and since I've gone to school, I've gotten the work I've needed to on myself and been away from a computer screen as well. That has helped a lot. I've not had an ocular migraine in probably 2.5 years now.
Wow, that's amazing. I'd be very interested in seeing what can be done, how I can be helped in that area. So I'm considering what would the cost of this be, if you don't mind my asking, because that would
No.
be
So
um,
obviously it depends on length like anything else. I try my best to keep it in a affordable range. We don't do gratuity. I did not mention that earlier when you kind of opened the floor for me, Dr. Ingram. That is the difference between me and pretty much anybody else with the same license as me. We do not do gratuity. And we start, I'd say a typical session, I do a plus 15 model. So a lot of times if you've ever even gotten like a regular massage, you'll notice that you go in for the 60 minutes and for 20 minutes you're either waiting on something or you're getting dressed or undressed and redressed. There's a lot of time that's taken away. So I do a plus 15. Even though I don't do unclothed work, I add 15 minutes in just for talking and palpation so I can assess you before putting you on the table. And you get the full 60. So I do a 75-minute and a 105-minute, which is the equivalent of a 60-minute and a 90-minute. My 75-minute, so hour 15, that is right now, that's right at 115, and the 105-minute is at $145, both for the cranial suture and integrative body work. They're the same pricing.
which is very
oh, this is
reasonable
great.
by local standards. And it would probably take more than one or two
Yeah,
sessions.
migraines are one of
Mhm.
those things that there's typically a lot, especially with chronic sufferers. Like I know I have several just personal friends that have had it since they were kids. You see a lot of it in developmental-ish years. They kind of develop that middle school, high school range when it's really chronic issue that causes it. There's a lot of underlying issues to migraines for people that have it chronically. Um, that's one of those things that it takes a while to get it out of that stuck phase, so to speak. And it's something that you have to just regulate because if you don't, it'll come back.
Mhm.
Migraines are one of the probably the most definitely one of the ones that is just you have to stay on top of it,
Mhm.
sadly. It is a very, very rough thing for a lot of people.
Okay, so in order to make an appointment, I go online and make an appointment. Is that correct?
Yes, the booking link is the fastest way to do it, but I also will book for people. If they best is to text message because my phone's on do not disturb a lot because I'm typically with a client or doing admin work, or the email that I sent in the thing if you prefer for me to book it for you. I know some people don't like using the booking softwares, which I get. Sometimes they're a pain in the butt for me as well. So if you want to book it yourself, you can use the booking link that's on that website I just sent, or you
Mhm.
can just reach out to me and I'll help you book it depending on what you need. We can talk about it. I'll answer questions and we can go from there.
And
Excellent.
if
Thank
you
you.
use the booking link, all of the forms that he has for you to fill out are on there.
Okay,
There are
great.
forms, and most of the time I forget to fill them out.
Yeah, they will be sent to your email. It's all so you can get it all done so you don't have to come in and waste time on forms. It's all digital and done through email.
And
Yes.
Betty Ann has her virtual hand raised. So what's up, Betty Ann?
I I don't know if this is something that would help or not. I have lower back issues, and I really pulled it out over a year ago. I've gotten to the point where I'm doing really well, but it's always like I know it's there, I know it's sore almost all the time, no matter what I do. And I go see a chiropractor I get deep massage and chiropractor once a month. And I do specific exercises to try to strengthen that area. And I still just have a lot of discomfort in my back.
That's another thing. I'm not going to ask you for your whole personal spiel on what you have going on a Zoom link, but comes down to what the underlying cause, what your chiro and your practitioners have told you. Um, there are other issues that can cause lingering pain. For me, um, adrenal issues kind of cause and I have fascial issues as well that cause my stuff to kind of have the same problem. Even when I get work done, I can kind of feel it kind of sitting there, especially in my hips because of my background with hockey. Um, I've found that really the only relief I've ever personally gotten with lingering issues like that is deep fascia, which is I can do with integrative body work. Typically, I try to stay within a comfortable range. Deep fascia is, I brought up Rolfing earlier. That's the specialty with Rolfing. It is painful. Getting to that layer of muscle is typically in fascia, is typically, we're talking muscles that are directly in approximation with bone. That's typically what you'll see is causing lingering issues, especially if it's compressing a nerve or anything like that. We have so many nerves in the muscles that are actually touching our skeletal system that those are typically what cause what you're talking about, that lingering issue. And those can be more painful sessions, so a lot of people avoid them. But if you want to get rid of stuff like that, the deep pressure, the compressive deep fascial releases is typically the way to go for that stuff.
Thank you.
Yes.
Judy, I see that you're unmuted. Did you have a question? Or Alexandra's unmuted. Hey, what's up?
Hey, I wanted to know, do you get a lot of POTS patients? And if so, what are, I guess what treatments do they typically get? I find I get a lot of headaches, especially around, leading up to my cycle and what have you. So I was just wondering if you do, what treatment would you recommend if you do get the POTS patients?
Yeah, so POTS being postural orthostatic tachycardia syndrome, which is where your heart rate goes up and your blood pressure goes down, Thomas.
So yeah, so I don't know if Dr.
It's a
Ingram smirking
dysautonomia.
because of this. But my girlfriend has it, so I think that's why Dr. Ingram was smirking. But yes, I'm very familiar with it. Typically, the thing with POTS is I find a lot of people with POTS because of what it is exactly have issues with deep pain, like deep fascial tolerance with that kind of pain, including my partner. She has a issue with being able to tolerate that deep fascial, the pain that comes with the treatment, but it also is beneficial. What I found with her is the biggest thing, honestly, more than any kind of body work that I can say, is going to be diet. Diet is a really big thing with POTS and hydration, which I'm sure you've been told before. That is really the number one thing you can do for POTS in relieving its symptoms. When it comes to work, the relief I've seen the most I've worked with two POTS patients. The most relief I've seen is being able to work with the fascia at a superficial level typically helps because of the intolerance. So I've done cupping a lot on my partner and my one client, and the cranial suture stuff has helped as well. Sometimes I've, I think the overcompensation with POTS and that the inability to get the oxygen and the proper blood flow to the brains, that cranial suture can help with the fluid pressure. It's only a regulation response though, and it's not a fix, so it would be something that would have to happen decently frequently to have a lasting effect in the sense of it'll only last so long no matter what. It's going to be something that you're dealing with the rest of your life, so it's something you have to stay on top of with more frequent sessions. But those are the two I'd say that work the best with the two clients I've had so far.
Yeah, and with POTS being a dysautonomia, meaning having to do with the vagus nerve and the flow through the neck, I can totally see that cranio-sacral would be beneficial to get things in alignment to make sure that that is working in the first place.
Yeah, I get a whole lot of neck pain, like right at the base of my skull. And like, I don't know, it just gets tight right there. So that's why I was asking.
Yeah,
Yep.
great questions. Well, thank you everyone for being here, and especially thank you, Thomas. This was great
Thank you.
information. And Mary will be back with you next week. Have a great day.
Thank you guys.
Bye-bye.
Thank you.
Thank you.